Welcome to the third New South Wales Smart Sensing Ageing Forum.
As Australian society ages, we need bold ideas and steely resolve to drive innovation to ensure we can age well and as independently as possible. This truly is a challenge and an opportunity of generational proportions.
We're not children, we're intelligent people who want to be treated with respect.
What we know is that the population is ageing. It's not something that's off in the distant future. It's a pressing problem that is right now.
We need to think about what are the outcomes that we desire? What do the people who are we delivering these services to want? And this is where we really start thinking beyond the scope of that this is the hospital's problem, this is your GP's problem, this is our problem. This is a human problem.
This vision of a digitised healthcare system, for a long time it has been a vision rather than a reality, and I think what we've hit in the last couple of years is we finally have the compute power and the infrastructure to deliver really sophisticated solutions.
Initiatives like Healthy at Home are so crucial. This program represents the future of aged care, a sensor-driven care ecosystem that empowers older Australians to live safely at home while reducing pressure on our hospitals.
Today, 30% of the data generated by the world is health data. 97% of that data is underutilised.
Sensors are critical, and we can capture information that we've never knew was available before. And in this brave new world of AI, we have an opportunity to now look at that data in a whole new way. The question then becomes, what do we do with the data?
When asked how appealing smart sensor technology was to assist extended independent living at home for older persons, half responded that it was very or extremely appealing.
The trick of it is to make sure that the bioinformation is stored carefully and safely. And then the last question is, who pays?
The sensors we saw, fall monitoring sensors, heart rate sensors, some various other sort of sensors, are the sorts of things that we've dreamt about for some time, but they're now real.
Imagine a world where a sensor goes off and you're automatically connected into a physio or a dietitian or a support worker to come out and help you at home. The possibilities are endless.
Wearables only work on patients that wear them. So I think understanding the barriers and enablers, and from a patient's perspective, it's really important.
Push the idea of what data we're talking about when it comes to health data. It's not just about heart rate, glucose. We could actually start to seriously map ourselves. The question, of course, is who owns that data, who has access to that data?
So we need to have this or a system that we trust as a custodian, administrator, and in certain instances, agent in the use of our data for our benefit.
What's on the roadmap is more personalised care and more preventative care.
I believe we can meet a wish that I think we all share, which is to remain at home for as long as humanly possible.
Technology is much more rapidly advancing than we are. We have to catch up. It is about technology, using technology as one tool in a toolbox to augment workflows. We will never replace people. We don't want to replace people, but we want to give our patients and our clinicians a better experience.
The next step is absolutely about implementation. We want to know how we can enable people to stay in their homes for longer, augment healthcare, personalised treatment, prevent illness, provide incredible assistance. It's that important. We've heard that again and again and again. So join with me in advocating for technology.